Hello and welcome to this special webinar with our special friend Vladimir Sachinsky. It's a Monday, not a Friday, but it doesn't matter. We're here to do an update webinar, the influence of coronavirus COVID-19 on the food industry, an update Q&A session. So welcome along to you. As always, type in the sidebar, tell us where you're joining us from, and literally watch it stream every country in the world. It's fantastic. So welcome along. I'm here just to moderate. The special guest and expert is Vladimir. He's either there or there, whichever way you're looking.
Thank you. Maybe we can touch even the fingers.
Yeah. Well, social distancing. Come on, let's social distance.
Yes. We are okay. Social distancing several thousand miles.
Exactly. So over to you, Vladimir.
Okay, thank you, Simon, and thank you all of you for connecting. I know that we haven't made some updates like 2 weeks ago, but I might say together with Simon, we had some small discussion, and we were among the first who really promoted something for the food industry, and it was really after that we saw a lot of other people from food industry promoting webinars, the things that you can do in food industry, etc. And over a few weeks we have collected a lot of information from food industry, also from our forum in IFSQN, what are the measures that you can implement additionally. Some of the measures maybe that you already know, but actually today's webinar we are anticipating to communicate more with you, because on the previous webinar we had lots of questions and we could not read all the questions in the chat. And additionally today we will leave some space and time to talk more about the question. I see one friend, Zoran Miloradovic, who is from the really famous company in Serbia. I will not mention the name. Hello, Zoran. And one of the measures were also communicated with them, and today we are going to mention it also. And it's a good thing to have people from all around the world, because we will have the inputs from all around the world. So let's start and we will discuss further. Yeah.
See you later.
So today we are going to talk about the influence of coronavirus on the food industry, and we will have some small update just to talk together about it, and small questions and answer session. With you today, Vladimir Surchinsky. We already had a lots of different webinars, a lots of updates. You can read the blogs and everything, and I don't want to talk about me anymore. I just want that we go straight to the point and talk about this situation that is dealing with the world right now. One more thing, I would just kindly ask you to ask questions when we come to the question and answer section, because if you put the questions right now while we are talking in this chat box, it could be that we have a lot of comments and we later could miss your question. So please just leave the question for the end, and at the end we will answer all of the questions in the question and answer section. So thank you. So I'm sure that you already remember from the previous webinar, there is a dashboard by the Center for System Science and Engineering of Johns Hopkins University, and here you can check. You will have the slide here and also the link where you can go and check what is the situation. So this is the situation. Actually, this is the print screen from today. We have over 2 million, going to 3 million of people. And this is something that we really need to think about, because this is the situation that is still very, very serious. Although in some countries we are getting the measures that are getting a little bit easier, a little bit relaxed, still we need to think about that we still have the this going upstairs line of the disease spreading, and this is something that's really, it's up to country to country. So in previous week, some of the measures have been reduced in my country, not a lot, just small measures, like we have additional 1 hour to walk per day, but other measures are same, like for example, social distancing, going to stores, work in companies, etc. Have some measures reduced in recent weeks in your country? And can you please just put what measures are reduced? Simon, have some measures reduced in England?
No.
No.
Not yet. No. They are talking about it. One thing that they are talking about at the moment, you have to live with your own family group or the people that you live with, but they're talking about possibly extending that to so that you can sort of meet up with another household, let's say your parents or brother and sister, things like that. But nothing's been finalized. Everything's still locked down.
You see, people are saying some India, no. For example, somewhere kids are allowed to go to school, not yet in the Philippines. Mandatory face masks in Texas. Since yesterday, children can walk with one parent for 1 hour every day in Spain. So you see, it is different from the different countries. And I think that measures are reducing. I just don't want to be negative. I don't know what will happen. They are saying that this is not the virus that will stay active in hot weather, but we have seen the cases in some countries that already have the warm weather that there are still cases. We will see what will happen. I just don't want to be negative, and but my consideration is what will happen in September. Will be there some again a new wave of this, and in this case I'm thinking that we will be locked down till the end of the year, and this is something that I really don't want to be negative, but sometimes we should think about it.
One thing I read in the paper today, newspaper, was that in Switzerland, Claudia's mentioned that as well, that they're reopening garden centres and hairdressers. So maybe you and I should take a trip over to Switzerland.
To a hairdresser. I think in my country also that hairdressers will start working. So you can come here also if you want. But okay, so what do we know so far? Actually, the information about the coronavirus is that there is no evidence that food is a source of transmission route, and this is the information that has not been changed in previous years. Years. I hope that it will not go to year, but in previous month, or this is the information from EFSA, also the information from CDC and from the FDA. They are all the same, but this is something that is good because we are sure that that it cannot be transferred by food, so our food safety system is not, let's say, endangered at this time. I also put some links here so you can go to this direct information that just to check what is going on. Is there some additional information about food safety topics, etc. In our previous webinar, we talked about some 4 steps of prevention, 1 step of recovery, and we mentioned a lot of interesting things on how you can implement some of the measures in your food production. Since we are going to share this presentation, you will have it in PDF. You can click on the links here to go to look at the webinar recording, and also we have made one accompanying article that can be found also on the link that is provided here. you will have a lots of inputs there, a lots of information and additional links for you to have the info on what to do, what to implement, etc. One of the documents that Simon shared to me that we have read together and think about was this document of the updated information from the Bundes Institute for Risikobewertung. And here there are lots of interesting information were shared about the viruses. We have been listening in previous weeks that virus is resistant and can be found on the surfaces, actually on the droplets on the surfaces, but can stay there for up to 2 to 3 days. And there is one updated information for the food industry. Also, you can click on these links and you can download this document, which is pretty detailed. But one of the main information was their answer to the question, can coronavirus survive and remain infectious on fixed and dry surfaces outside human or animal organism? And they answered that the stability of coronavirus in the environment depends on several factors. This means the temperature, air humidity, and surfaces conditions, as well as the specific virus strains and the virus quantity. I must say, these are all familiar to us. When we talk about microbiology, when we talk about even the bacteria or the viruses, we always mention that there are several factors such as temperature, air humidity, surface conditions, etc. And actually they didn't share some really detailed or valuable data regarding which temperature or what air humidity or which surface conditions, what is the strains or the quantity, etc. You know, for bacteria it is very familiar for us. But they mentioned in general, human coronavirus are not particularly stable on dry surfaces. This is good to know. And inactivation in dry conditions generally occurs within a period from few hours to couple of days. This is very, very valuable information for later that we are going to talk about some packaging material and transport. So initial laboratory test by an American working group for the new type of coronavirus show that it can remain infectious for up to 3 hours as an aerosol, up to 4 hours on copper surfaces, and up to 24 hours on cardboard. So this is interesting because of the transport boxes, and up to 2 to 3 days on stainless steel and plastic following some heavy contamination. But we still need to think about what is a heavy contamination. Is it a big droplet or a small droplet? You know, we really need to think about this. Additionally, the questions that were very interesting for me was, can the new type of coronavirus be transmitted via dishes and cutlery in canteens and other places people eat together? Because we will see with this lowering the measures that cafes and restaurants and canteens will be open. And actually with this lowering of measures in our own canteens, in our own companies, we need to think about transmission of these viruses. But they say that coronavirus can generally reach cutlery or dishes through an infected person sneezing or coughing directly on them, and they can survive on these solid surfaces for some time. So what would be here important is that actually you prevent with the measures that you implement possible coughing or sneezing directly in the production. You can use the face mask, but also you should train your employees to work and to respect these general hygiene rules. And here also what we need to mention that smear infection then can appear to be possible if the virus is transmitted via cutlery or the hands to the mucous membranes of the mouth, throat, or eyes. However, they are still not actually yet aware of any infections with coronavirus via this transmission path. But actually, with some of the auditors, we have already discussed about virus that is well known, and this is hepatitis. And let's say hepatitis can be transferred, but this is only via dirty hands and also the possible traces of blood. And the situations with this virus, like hepatitis, is always transferred, and mainly it happens in the restaurants and cafes. So we need to really think about this situation and really think about all the implemented measures that are for our employees working and directly handling with the food. To help you with this, we have found several guidance for your food businesses. And actually, these guidances are presented from the start of the April. You have World Health Organization guidance for food businesses. I'm not sure how really detailed and helpful this is, because we know how they've been helpful in previous weeks. And also we have this European Commission information about COVID-19 and food safety. So this could be really valuable. On these links, you can click it and you can download these documents. It could help you in your food business to develop or guide you through this situation. So also, please, if you have some other useful guidance, you can please share the links. You can put it and comment it in the chat box. This useful guidance is for all the participants now, and of course you will have the presentation later and the slides with all of these links provided. But if you have it right now, some useful guidance, please just click it and share it here, because it would be really useful for other participants. Every country has developed some guidance in the previous weeks, but first what they started is the guidance for all the people. Then they started with the guidance for the medical institutions, and somewhere during this they forgot to issue the guidance for the food industry, but food industry is actually working from the day one with the full capacities of working 24 hours, 7 days in a week. And actually, food industry has been under a lot of pressure because of this coronavirus pandemic. So they issued the guidance, let's say, last for the food industry, which is not so perfectly good. But good thing is that, let's say, we have this International Food Safety Quality Network. We have some other networks where we communicate, and it's good to have all of you food safety professionals here. So let's look at some of the measures that we were talking about in previous weeks with industry. One of the things that we didn't mention in previous, we mentioned about the packaging, but we still didn't have the information about on our previous webinar about how long the coronavirus can stand on the surfaces. And here we start thinking about some returnable packaging and the transport packaging, especially, let's say, these crates from the meat industry. Also, these big barrels used for water that are also returnable, and thermo boxes for the catering industry for transport of the food that is ready meals. And here we need to think about possible cross-contamination routes, because we have our own employees that are handling with this, but also we have people somewhere in other company or retail or in other smaller companies that are not operating with food, handling with all of this. Like, for example, these water balloons. We have our own employees handling with these water balloons, then we transport it, then we have some people in the transport that are touching it, then we put these water balloons on places to pour water in some companies, and here people are touching it, standing around, etc. So there are possibilities that coronavirus can be on the surface of these barrels. Of course, these industries who are filling these barrels are washing them, are disinfecting them, are taking every care that is needed to clean it. But in some cases, I must say, I have one client that already stopped filling these barrels. So they are filling only plastic bottles, smaller one, and this returnable, they stopped filling it because they couldn't be sure that with all the use of cleaning and disinfectants that it is clean, and they don't want that any case is connected with their own barrels. So this is only their own risk assessment. Yeah. Regarding the plastic crates for transport of meat, you have this handling from industry to industry, from industry to retail, and then retail is returning it. You need to wash it, you need to clean it, and you need to think about disinfection agents that you are using here, especially to get some confirmation from the producers of these disinfection agents. Are they suitable for the viruses? And this would be very useful that you have some information for this. Thermo boxes for transport of ready meals, really you need to think about that, because transport boxes are should be easy to clean, but sometimes you have several people handling with this, how you are going to clean it, which disinfection agents you should use, and also shall you use some tunnels for washing or whatever. So these are all the things to think about. Returnable packaging, also transport packaging, we didn't talked about it. Additional thing, what one of the companies has been implementing in previous weeks is the packaging material that is still not used, packaging material for transport made of cardboard, made of plastic, etc. And what are they actually doing? They are ordering the packaging material. They are putting this packaging material to their warehouses or the storage area, and according to the information, the coronavirus can abstain to 3 days on this packaging. They are labeling this packaging and saying, okay, we will not use it till the 4th day. So this is one thing that you can also implement. The second thing, for example, one of the producers have implemented the UV lamps. For example, they put a smaller amount of packaging materials in specified area or the room where you turn on the UV lamps, and this is how they, let's say, sterilize this packaging material. So this is just the things that you can use. Some of them needs money, some of them does not need money, so please, it depends from your industry, it depends from your amounts of materials that you use. Next are catering and restaurants. Some of the measures we did not mention in the previous webinar because we included only the producers and directly the food industries. And actually the catering restaurants are the ones that will be open with this let's say measures that will be lowered in next period. And we here need to think about serving of the food, also dishes and cutlery, because you saw from this German institute that they already mentioned that there could be a possible transfer from employees to dishes and cutlery. And actually one of my clients has already thought about or think about using the dishes and cutlery that are only for one use. So of course you cannot do this in some exclusive hotels, exclusive restaurants or canteens, etc. But in some cases you can use maybe just the dishes and cutlery that are for one use. In other cases you need to think about washing and disinfection. Here of course about disinfection, not just the dishes and cutlery but also all other things on the table, for example of the restaurant. They say that, and as a food experts, that dirtiest things on the table are the salt and pepper and the oil, all of this glass cutlery that stands on the table. So this is actually the dirtiest things on the table, and we need to think about disinfection, about washing. But not only this, we also need to think about the cloth that stands on the table, how to wash this, how to disinfect this. And here you need to speak with the suppliers of disinfection agents. Again, are these disinfection agents that you are using effective against the viruses? Once again, we need to think about training. So actually proper handling by employees, and also with this proper handling by employees, we will prevent some cross-contamination. Someone mentioned, but one-time use cutlery can also have the virus on the surfaces. Yes, I agree with you, but maybe we can order some cutlery that is closed, let's say that has the cover, like small forks and knives that has the some PVC cover, like the protection that only can be opened by these guests. So these are only just the guessings and solutions that you can use. But for me, if you already have some dishes and cutlery, please think about the process of washing, think about the training for employees in case that some of the employees are sick. Don't use them, and this is something that we need to think about. I must agree that these things, it is scary, yes, that these things are mentioned in COVID-19, but actually all of the food industries should already have these things in place and implemented, just to be a little bit stricter in doing all of these measures. And of course, after the opening of restaurants, social distancing is something to think about. One thing we mentioned, but we didn't develop it a little bit detailedly with some of the clients. We talked about also primary production. So the primary production is something that will start at the end of the May. We will have through June, July, doing the fruits and vegetables. And here a lots of these companies are engaging like seasonal workers. We have a lots of transport packaging here, like crates, plastic crates, cardboard boxes, etc. And for example, I spoke with one of the producer who is packaging the raspberries, and we talked about these plastic crates. So actually they as a company are providing the plastic crates for the suppliers, for the primary producers, and they are also as a company doing the washing and disinfection of these plastic crates. So we agreed that they wash, disinfect these plastic crates, and after drying they do the verification. They just take the sample to confirm that it is clean. So, and they will do the cleaning with and disinfection with agents that are efficient against the viruses. So this is one thing. You will deliver to this primary producer the crates that are clean, but what will happen next? If there is someone with dirty hands or something, of course, I agree again that some measures of hygiene should be also there on a primary production. But again, in this case, I think we should use this COVID-19 situation maybe to develop additionally some, let's say, awareness among these people, because I know it's a little bit frightening to have this disease, but because of this frightening, we could use it a little bit to put the awareness among the people. So let's think about the seasonal workers. Let's think about hygiene, to provide them enough water for hand washing and disinfection agents, and also to implement some additional measures, like maybe we can do the disinfection on every hour, the disinfection of hands. Someone talked about the face protection, the masks for the primary production seasonal workers, and I mentioned yes, they can use it, but then someone mentioned, yeah, but the price of this will be too high. If you have 30 seasonal workers, you need to buy these these masks last for 3 hours, they will work all day on the field, etc. Then we agreed maybe that you can use some face masks that are washable, that are man-made and washable. So maybe you can, after each day, wash these masks and again iron it and deliver it again next day. So these are only some of the solutions. So in these cases, we will need to think about additional trainings. We will need to think about supplier trainings, of course, because some of these primary producers are your suppliers. And we will need to think about, of course, transport vehicles. So this is transport vehicles that are used for transport of primary products, how they will be cleaned, how we will make sure that something is okay, and this is just for primary production. Of course, all of this is connected with transport and, of course, storage. And here we need to talk about hygiene of transport vehicles. We only base on this that virus can stay on the surfaces, and this is only for the protection of employees, but also the customers. And actually, I think that we will not need to change anything regarding the hygiene of transport vehicle. We just need to reevaluate the disinfection agents that we are using. But one thing that should be already implemented is the control of drivers, because in some cases you have the drivers coming in your facility, in the company, and then they are going out from the vehicle, and then they are going inside the production, they are communicating with other people, etc. So this should be controlled so that drivers are not entering the production, that they are not even going out from the vehicle, and this is something that you need to implement if you didn't already implement it. Also, what you should think about is the cases when you have some transport that could go to cross-contamination, meaning that you have several products, or transport in cases that there is one vehicle collecting the products from several producers. There are some cases, and in this case you need to call all of these producers and to make sure that they are actually that they are already implemented measures to prevent any cross-contamination, especially in this case. One, or let's say two processes that I think and discussed with the food industry, but also discussed with the auditors, that are really affected or could be later affected, are the food defense and food fraud. Why these processes? Because actually now everyone is really focused on COVID-19. Everyone is focused on implementing some additional measures to protect people, but they are forgetting to protect the food. They are only focusing on this, let's say, basic things like hygiene, and let's have this basic. But on the other hand, we need to think about food defense and food fraud. Actually, there are some inputs that a lot of food fraud things are going on right now in this COVID-19, because people need food, people need supplying, retailers are asking for more products, we are producing a lot, there is a lack of raw materials. Sometimes people are not thinking about, or the producer are not thinking about this quality, and they say, okay, let's do this just to provide the products, nobody will be angry on us, etc. But on the other hand, we will have the food frauds on our market, and you will see after this situation is over, we will have a lot of products that are let's say labeled as a food fraud. Regarding the food defense, this is also a bad situation, because in this case you will have possible loss of control, possible, although we implemented a lots of measures controlling who enters, who exits the company, especially the external visitors, there could be issues of the unsatisfied employees that could put something in the product, and this could be due to not providing additional measures of protection, especially in third world countries. And this is something to really think about. One of the things I spoke actually, one of the representatives of these companies here is the food fraud and also the sending of the samples of the laboratory to the laboratory sampling, and this was also an issue in previous weeks because laboratories also stopped operating or operated in a different manner, but you still need to send your products for some laboratory sampling externally, and this is something that we forgot to talk about in previous webinar. So laboratory sampling is something that you need to also think about. Is this supplier working? Is this laboratory having enough employees? Are they working in some different shifts? Can your product be, let's say, safe or verified without this external laboratory? Is your internal laboratory enough? Do you have the internal laboratory, etc.? Because of this, we are also promoting some practical food defense and food fraud training. It will be in May, 29th of May, and here we will talk about food defense and food fraud, some practical things. Again, we are going to connect this with COVID-19, but mainly we will focus in this training course the requirements of GFSI recognized schemes like FSSC, IFS, BRC, SQF, Global Gap, and also provide guidance on how to comply with their requirements. And this webinar we specifically designed for the IFSQN with two parts. First part that covers all that is needed to implement an effective food defense plan in your company, and second part also covers all that is needed to implement an effective food fraud prevention plan in your company. And through all of these parts we are going to present really practically and share some of the valuable documents that you can use. And also we will have some cases that are interesting, and actually you will learn how to have it in your company really practically, how to be really the representative of the food defense and food fraud team. So here you will have the link in the offers. You can see already that it is putted, and with this you can connect actually on the training on the May of 29. So I will be there welcoming you and talk with you about these topics. Regarding the food safety hazards, some of the things that we implemented in previous weeks regarding the prevention of cross-contamination of the COVID-19, we implemented in some cases the face masks that in some companies we didn't use earlier. We implemented gloves. In some cases we didn't use it earlier. And these new measures are all on place, but we forgot to control these measures. So for example, we put some PVC protection to separate employees one from each other in the small areas. We put some PVC protections like in the face masks, etc. All of these are potential physical hazards and we forgot to control. So what you will need to do is to check your checklist for the control of physical hazard and also add all of these PVC protections, masks, or whatever. Additionally, I mentioned that some of the industries have implemented additional UV lamps. Again, this could be a physical hazard, but also it could be that it is not under control, so you will need to add this as a physical hazard. Again, when we talk about gloves, this would mean potential microbiology hazard because people who are not used to use the gloves in some industries, you know, in a meat industry, they are used to use the gloves. In the dairy industry, okay, you know, in some places they're using the gloves. But, you know, in the confectionery industry, in the bakery, they are not used to wear the gloves. So in these cases, people who will first time put the gloves, they will think, okay, I have the gloves, I don't need to wash hands. So potentially you have here some microbiology contamination. I remember sometimes that there were employees going even to the bathroom with the gloves on. So this is something to prevent through the trainings and to the really detailed information. Yes, Sonia, I agree. In fisheries, they don't use gloves, but for example, some of the companies in fisheries will implement it additionally to use the gloves for the prevention of COVID-19. But in some cases, this is only in some cases for the people who are not washing the hands, they will need to really think about potential cross-contamination and microbiology. Okay, so this is some food safety hazards. One of the things that were very interesting for me was the article provided by Food Safety News, and on this article they said that comparing to the month of the last year, same month of the last year, there were a lot less recalls and withdrawals in the same period. It is said that probably the reason is that because of this situation of COVID-19, companies are not informing enough the regulations about recalls and withdrawals, and sometimes they are not communicating properly. So what is important is actually the compliance with the regulation. You still have to comply with the regulation, even though that there is some let's say crisis situation. You still need to comply with the regulation, and you still need to comply with the internally developed procedures for recall, for withdrawals, etc. Please make sure that you again respond to all the compliance. I have the information that compliance are regular. In some cases there are even increased compliance, but you still need to communicate with your customers, and you still need to communicate and respond to this compliance. In case that you have recalls and withdrawals, please act according to your procedures, and please also comply with all the regulation and inform the people about recalls and withdrawals. So this is something not to forget in this crisis situation. So after all of this finished, we will have to consider some steps of getting back to normal business. I spoke with lots of industries, and some of them has already developed some checklists. And these checklists are covering actually what is needed to be performed before we go back to the normal business. So some of the industries has stopped some of the production lines, and after situation is gone, we will need to come back to the normal. So this would include to check the implementation of good hygiene practices. It would need some preventive maintenance, maybe it would need some verifications, also to check maybe some hazards, etc. And the good point here would be to develop some checklists that could guide you through the steps of get back to the normal. So this is something that you should really think about. So have you already considered some steps of getting back to normal business? If you have considered, you can comment it in the chat box. We in the previous webinar talked about one recovery step, and this is step where you need to think about some business continuity, but this is only regarding the production area, let's say, to be more precise. So if you have already considered some step of getting back to normal business, please share with us. And also, if you have some models of checklists, you can share it on the forum. So we are all going to be really thankful to have this. And with this, I just want to thank you, and you stay healthy. And we are going to continue with the actually some questions and answers. We still have time, so to answer some of the questions that you put here.
Yeah, that's great, that, Vladimir. Thanks very much. Excellent update, and also the links to further resources will be very, very helpful indeed, I'm sure.
Mm-hmm.
So let's get into the questions. I've highlighted one there from Lorenzo. Have you got any info about ozone as disinfectant for facilities and air treatment?
Well, actually, I heard about it, didn't go in deep about this. Regarding the ozone, I heard that it can be used as a disinfectant, but it depends on the surfaces. It depends of the not just the surfaces, but area where it is used, and you need to think about how to supply and how to use this ozone. One of the companies, I think it's dairy industry, they already talked with me about this. They are using it for air treatment actually, but they have been using it even before the coronavirus, for the air treatment. So this is actually something that you can also use, but this would be very good that you contact the supplier of this treatment and to get valuable information. And of course, the good thing would be that you communicate with the company that is already using it. I'm sure because of the food industry, we are all connected. You can speak with people who are already using it.
Okay, thanks. Alina, do you believe that employees in butcheries and fish markets, I think that should wear gloves? And generally, what's your opinion on gloves versus not wearing gloves, pros and cons of that?
Yeah, I think I already wrote something about it in the forum in IFSQN. Actually, the thoughts are divided. I had the situation, I worked in the retail, we had the situation without gloves and we had the situation with gloves. Of course, you need to make the awareness of employees on this scale so that employees are washing their hands with the proper sanitation, disinfectant, etc., and it is done regularly, etc., etc. But on the other hand, you should do the same, and they additionally have the gloves. And in some cases, these gloves are making them, let's say, they are sure that they will not transfer anything. They wash their hands less than it should be. Even though I already mentioned, I had a case of one butcher going to the bathroom with gloves. So it's bad, but it all depends from the company, depends from the rules, depends from the fluctuation of employees, for example, and depends on the your trainings. So if you have really good trainings that can be implemented fast, and you have additional controls or the verification of the trainings, this is good. Also, if you have enough gloves that they can change it during the day, you can track it, how they comply with this. So for me in the markets, for the people who are communicating directly with the food which will be, let's say, consumed immediately, like restaurants, in kitchen restaurants where they prepare you the food on the plate, where they serve it, also in some fast foods or, let's say, fish markets or wherever, where they handle some of the food that you are going to consume immediately, then you should think about using the gloves. And you can track the use of these gloves, let's say the amount per month. If you say that per employee they are using like 20 gloves per day, then we can be sure that they are washing, they are changing, etc.
Yeah. Okay. Pratiwi, if an employee gets positive COVID, should the organization do a recall of the product?
Well, I'm not sure that you should do that. Because we already informed you that our EFSA already gave the information that it cannot be transferred by food. So this is something that is really to consider. You can do the risk analysis. Did that employee had some contact with food? Are there any possibilities that the food is endangered? But actually, I wouldn't recommend and recall because of this.
Okay, Mal, under what conditions in the food manufacturing setting can the COVID virus become airborne, and how big is the risk of airborne transmission in the form of droplet?
Yeah, I'm not sure that we can answer that. I'm sure that you can find lots of information because we hadn't do any of the investigation of the airborne and how big is the risk of airborne transmission. We only know from the info provided and the links we provided for you that we have discussed together actually that there are possibilities that droplets can be on the surface of the some products, or let's say on the surface of the packaging material or something like that, but actually that it could be transferred like this, it's not even said or
No.
mentioned as the information. Yeah.
Okay, Mal, how often, what frequency should frequently touched surfaces be cleaned?
Oh yeah, but Marl, it depends. It depends, if you have, I will just give you an example. So you have two shifts of works. These two shifts, for example, are coming in a different time, and you will have the cleaning before the first shift. Then you will have the cleaning when this shift goes to the lunch break, for example, before and after the lunch break. And then you will have one cleaning after this first shift ends. Then you have the second shift, then second shifts, again, you have the cleaning before lunch and after lunch, etc. So this could be implemented. For example, one company implemented to perform the cleaning of touch surfaces on every 4 hours. So this is something, yeah.
Okay, Mal, another question. Effectiveness of UV in killing the virus. You mentioned some things about that. Can you just sort of recap on that?
Yes, I mentioned that UV is effective against killing any virus or bacteria. Many, let's say many, not any. And they say the info that it is also for the coronavirus. And I can find some literature for you, but if you type it in the Google, you can find it. It's nothing additionally that I can send it to you. So you just go to try the UV lamps and you will have the information. Just a second to see, do I have some additional to share? I will try to find it right now and maybe share it to you.
Okay.
But you can ask the other some other question if you have it. I will try to find some.
What about using fabric masks instead of the disposable ones in production?
Yes, it's okay. I talked about this because, for example, what is here, an input is that you have this fabric mask, and then you work with it like it is the regular uniform of the employees. So you actually use this fabric mask at the end of the shift. For example, you put it on the washing and you wash it with cleaning agents or the disinfectant, and after it is dried, you iron it, and then it is used next day, like with the other, let's say, work uniforms.
Okay. Kern. How should verification of frozen products be handled, since the virus can survive for a longer time on frozen products?
Yes, but we still don't know for how long, or I'm not sure. I didn't have the information for how long it can stay on the frozen. I don't know. Do you have such information, Simon?
No, best thing is
No,
probably ask on the discussion forum and see if anybody's similar industry has read literature on that.
Yeah.
Sources. Shiva. In some companies, usage of face masks, helmets and spectacles are in place. However, when an operator is working in cold storage area, condensation occurs and creates issues. How can this be tackled? So PPE, personal protective equipment, is causing other issues.
Yes, we handle that. So you can use it only as there are available, let's say, sprays on the market that you can use it. You call your persons who are dealing with safety equipment, and you have some sprays that you can spray it over the glasses and everything, and then they are let's say not so demanding regarding the temperature changes between the body and the outside, and it prevents of making the condensation. Also, what we have done, we put some of the equipment like this in already cold area, so it is cooled down before people puts it on the face, and it lowers the condensation, for example. But this is only for some time. It's not for the whole time.
Okay, EHAB, as COVID-19 up to now is not foodborne disease, during supplier audits, shall we look for preparedness, actions taken and precautions? Although my audit is food safety, not what's SC, I'm not sure. If so, what should I look for in a supplier?
Well, I must say that if we look at the GFSI manual and recommendations, GFSI standards, they are all recommending now for the auditors to check what companies has done in the name of this COVID-19. So actually you should look at the preparedness and actions during your supplier audit, because one of the points is the handling with the crisis situation. So this is every standard, food safety standard has this point or the requirement handling with the crisis situation. Since this is a crisis situation, you should go into a little bit how they are handling it. And in this case, you can go to the BRC or website, or even the IFS website. Over there you can download the interview questions that they have prepared, and this could help you in how deep you can go regarding these questions for your suppliers. But you should check it, of course.
Okay, and Amit, can detergent washing remove virus from surfaces, or does it need to be an approved disinfectant?
You need to, Amit, you need to check it with the supplier. The supplier of this detergent will help you in this. Some detergents has already inside some let's say ingredients that could influence, like chlorine or some additional disinfectants already inside the detergent. But you should check your specification, your safety sheet, and also contact the supplier of your disinfectant.
Okay, Sandy, frequency of mask changing?
Well, they say that masks changing, that masks are effective for 3 hours. So actually, they should change it for 3 hours. In some companies, they implemented it to change it at every 4 hours. It would mean when you come to work, you put the mask, you have the first break, let's say after 4 hours, then you change the mask, and that's 2 masks per shift of 8 hours, if the shift is 8 hours.
Yeah, Bruce Perkin just mentions
yes.
FDA says categorically no recall. Yeah.
And Bruce is mentioning changed mask when they get dumped. Yes, you are right. This company also mentioned this on every 4 hours regularly, but additionally, in case that it is dumped, employee needs to change it.
Yeah. And obviously a change procedure that involves hand washing afterwards as well, and a way to put the mask on and dispose it and everything. Okay, Bavian, how to tackle the virus on one-time use cutlery?
I don't know. Let's discuss about it. So, one-time cutlery, you should first ask your supplier of one-time cutlery, have they implement some of the measures to prevent any contamination of this cutlery. So this would be the first step. You contact the supplier. The second step, in case that there is no any protection outside for this cutlery, you can ask maybe for the supplier to provide the additional protection of this cutlery so you don't contaminate the cutlery before the serving to the guest. So this could be the second step, and I don't know.
I suppose the cutlery, when it's manufactured and packed, is probably weeks before use, so it cannot survive on there. I think we've read in the earlier
yes,
shared.
I must agree also with you, Simon. Yes, we should also check. Yes, this could be one of the measures. Of course, when you receive the cutlery, you do not use it for, let's say, 3 days. It stays on the, or whatever. You should check the time on the surfaces. You don't use it, and after 3 days, then you use it. Yeah, maybe we can tackle this
Something
with
like that.
yeah. So these are several things that you can do. You have to think about it a little bit.
Sanitizing fresh fruits and vegetables.
Yeah, it's always a good thing.
With
well, I don't know how to say it on English, how it is called on English, just to see the Google Translate. I don't know all the words on English, you know, and some of them that I know are not so good. Oh, it's baking soda.
baking soda.
Yes, maybe you can use the baking soda for the fruits and vegetables.
Really?
Huh? Yeah. You put some in the water, and you put. And also, someone is mentioning vinegar. You can use you can mix the lemon juice and baking soda and disinfect your fruits and vegetables, for example.
There you go.
How's that? Is that interesting?
It is. Matteo Coleman has translated his procedure, which is a checklist for getting back up and running after COVID. Yeah, Matthew, I'll send you a message, so I'll check that for you if you want me to check that translation. Can you see another question?
Well, no.
Let me just send that to Matthew. Okay.
Yes, Bruce Perkin is saying FDA recommends only fresh, clean water for washing vegetables, and I might say that this could be good. This could be the best solution. You know, you just use the clean water and wash it. It could be enough for the fruits and vegetables. Someone is mentioning also, let's see how this is translated in Google Translate. Just a second, maybe there is no translation for this. Zeolite. This is a mineral. You add it also to the water, and you can use it for the removal also on some pesticides outside, etc. So this could be. There is a lots of things you can use. Yeah. Yes.
Okay. Moises is asking how recommendable are tunnels for disinfecting people?
I don't know. I have not used the one, or they haven't built the big one enough for me to stand in.
Okay. Let's see. So
let's just check this, for example. Chris is saying, what are your thoughts on wearing masks in food production? Just a second. In food production facility, from a perspective contamination point of view, with people touching the mask or the mask becoming wet with saliva. Yes, we already mentioned it. You can prescribe the rule that masks are changed on every 4 hours, and also that in case that they are get wet with saliva, it should be also changed. So this could be something. Yeah.
Okay. Allah has said the measuring temperature is the fastest tool to know if the person has a virus, or is there another fast way? That's quite widely used now, temperature measurement of people.
Yeah. This could be the fastest way right now at the moment. So this could be the use of these thermometers with infrared, for example, measuring of the temperature.
But then Claudia said that an infected person already spreads the virus before having fever. There is still a lot of unknowns.
Yeah, this is something that we discussed. We have a lots of guessing here among the, let's say, people who are talking about this COVID-19 from the medicine point of view. We have a lots of things that are not clear here. This is why when we read this document from the German Institute about where they are saying it depends from the water activity, it depends from the amount, it depends from the temperature, etc. This is general information. This is not something really specifically detailed for this COVID-19.
And this is the thing, when we're talking about we're in a manufacturing production and we're wearing gloves or we're wearing masks, is it to protect the food or is it to protect yourself from your colleagues or vice versa?
Yeah.
Yeah.
What we always forget to do, for the easiest thing in industry, is that you put all the measures, you implement all the measures. You implement the mask, you implement the gloves, you implement everything, and you say, okay, this is it, this is enough. But nobody is really sitting and have the table with all the prerequisite programs and saying, okay, let's see, masks. Let's evaluate the probability, the incidents, what could happen, how much money we're going to use for this, is there possibility, etc., and really do some risk analysis. Do we need a mask? Do we need the gloves? Do we need some other types of protection, etc.? Because people are always, going to look at the side of the, going to literature. It is written there. We will use it like that.
So doing anything, the recommendation is you shouldn't do anything without thought. You just need to think.
Yes.
Why are we doing it?
Every standard it's the steps that we really go. It's the steps that we really go fast across them. So the first step, defining the team. So this step is very, very important, because you don't define the team of the food safety team just to have it on the paper. This team should really sit and consider all the points of your food safety system, the points of your prerequisite programs, the points of your operational prerequisite programs, the CCPs, etc. So actually, this food safety team should also consider which the standards are saying you should implement, or the common sense, you should implement the prerequisite programs. You should implement the prerequisite programs, but they are not saying how. So you need to think about this how, and not just to comply with the auditor. I really dislike when you have the company just saying, okay, you as auditor said that we should do this additional cleaning, so we are doing it. I expect from the companies, and lots of auditors do expect from the companies, that they really, if they say we are not going to implement additional disinfection because of this COVID-19, I as an auditor would say, okay, can you prove me that your existing disinfection is okay? So if you can prove it as a company that it is okay, that it is working, I say, okay, you don't need additional things, you know.
Yeah.
So this is the same with all other measures in the food safety.
Okay. Matthew is saying Liège University in Belgium is working on a program for disinfection of disposable masks as there is a shortage of this material. They use dry heat. It works. They are checking how many times we can do it. So
Yeah.
dry heat kills it. Okay, right.
So this is the classic sterilization with the dry heat. You just put the piece of you open your home, the
Dry.
no, the baker, the baking
The oven.
oven. Yeah, you open the oven and you put something inside, and you put the temperature high on the 200 Celsius degrees, and this is the heat sterilization. That's it. This is dry heat sterilization, it's not so like something to develop on. It is really easy.
Okay.
Yes, Zoran Miloradovic, here is some smart guy from Serbia ironing. This is high temperature, and if you're it's on a steam, that's even higher temperature.
Okay. One last question there. If I'm infected with COVID-19 and some sweat drops off me into some ready-to-eat food, there you go. There's a kebab, Vladimir.
But it's not transferred by sweat.
Okay.
It's from the droplets from your mouth, so directly from your infected respiratory organs.
Okay, if I sneeze on it.
But if you put your finger in your nose and then you put it on the food, then there is a possibility.
So good hygiene is very important, and that
Yes,
is always the case, whether it's COVID-19 or not.
Yes.
Okay,
yes.
Right. Thanks very much, Vladimir. What we'll do is we'll send the recording slides, and I will do a certificate for it as well. And just one thing in the background on your shelf there is the word smile.
Yes.
And throughout all this, let's not forget to smile, ladies and gentlemen. It's not the end of the world. It is a crisis, but we'll get through it, won't we,
Yes.
Vladimir?
Yes, and I must say that I really congratulate to all the food industry, because really coping with this and having the strength to work 24/7. It's not just the medical people. We should go on our terraces and really clap for the food industry, and nobody's saying that, and this is something to.
Well, we're saying it, so let's give them a clap now, Vladimir. Come on.
For the food industry.
Yes. Clap. Okay. On that note, we'll end it. So thanks very much, Vladimir. We'll see you soon.
Thank you. Thank you. Bye.
Bye.